I think the first thing I would say is healthcare is never going to be the same again. And so we've gone through, we have seen a massive change in our industry. And I hate thinking of healthcare as an industry, but it is in the US. I mean, we went from all of our patients, we're seeing you in the office, this model that's been around forever, to now we're seeing people virtually and learning how to do that. We're learning, you know, maybe I don't need to do this lab work as often because I don't want someone coming to my office. I think we also have to overcome our fears, because one of the things with this epidemic that happened is healthcare providers in general were so you know, overly seen in people getting really sick and dying from COVID, that it's been scary to think that we never thought this would, especially the way it was handled in this country. And I remember early in the pandemic, I had a friend of mine who is a internist now working in the pharmaceutical industry, who wanted to do something to give back and went and worked doing testing for COVID in a hospital in Brooklyn. And I knew someone who was able to get me some KN95 masks sent from China through family. And I got those and was sending those to him. And so that's so personal that it's scary. We were losing ourselves, we were losing our families, we're losing our patients. And so I think overcoming that is important. And now we're trying to go back to something that's normal. I don't think we even know what that is yet again. I mean, it's hard enough to like eat in front of other people again. I mean, I met my I saw my real estate agent yesterday. It was the first time I've seen her whole face. And I didn't recognize her. So it's really, it's figuring out what happens next. And also sort of going back to some of our other themes we've talked about is the medical profession. And this is physicians, PAs, NPs, nurses, need to start, we need to realize what are some of our minimum requirements to keep ourselves safe, to keep our patients safe, to provide good care, because we've gone below those minimums in so many areas, and we need to push back and say, you know what, me seeing, 30 patients a day is not doing anyone any good. And, having people, get rushed through their educations is not doing anyone any good. And it just, this is a place where we need to push back. And I know some people have said we've already lost the fight to the insurance companies and the middle management parts of medicine and clinical work, but the truth is, we haven't already lost. As long as we exist, we can do this. And so we need to use COVID as our chance to push back.
Yeah, I completely agree there. I mean, I look at this one from an economic lens, and I look at, when we look at recessions and just the history of recessions, you see companies in general become more lean. That's the term they like to use. Lots of layoffs, right? Because now the political atmosphere is, you can do it, right? You can lay off a lot of people in a recession. And then you can look at where your areas for efficiency are, right? What that really means is a bunch of people are losing their health insurance. A bunch of people are losing their jobs. The company is making other people work harder, dedicate more hours, trying to maximize profitability. That's not what we're about here. And that's not what healthcare should be about. And unfortunately, I think we are seeing this with the recent epidemic, this recent pandemic, is that we are seeing healthcare organizations see that they can maximize labor from nurses, from physicians, from whomever, and try to get more hours out of them, especially I think residents too. And it becomes a numbers game, a profitability game, which should not be allowed in healthcare and will not be allowed in healthcare. I do see a lot of hope too. I see patient-centered hope. You know, as much as I detested the last administration, we did see Seema Verma rescind some regulations around telehealth and CMS requirements. And we did see some regulation fall away specifically around telehealth with executive orders. I want to keep those telehealth, personally, I want to keep that telehealth access there, especially for rural settings. It is so important for folks that otherwise would have to take a day off of work, especially voice-only telehealth for our older folks that don't know how to use Zoom, right? And they might only be able to see a primary care provider through their phone by calling them, right? They're just areas that we really need to protect, that we've seen a reduced regulation structure around. But that also means that healthcare companies, hospitals, clinics, general organizations have a duty to protect their providers, right? You are the best provider when you're able to take care of yourself. You're the best clinician when you're able to show up fully, right? And that means being authentic. That means being able to be cared for. That means being able to have the time to take care of yourself. That means being able to have time to bounce stuff off of colleagues too, and really work as an interdisciplinary team. And so self-care, having a system that respects that and honors that, you know, having ways in which we achieve more patient access post-COVID. And honestly, I think with this new administration, we're going to see a lot of additional access points for federally qualified health centers. I think we're going to see additional funding in general for healthcare. And I think there's going to be political momentum, especially with how many people lost their jobs during the pandemic. And that meant how many people lost their insurance too, and then eventually switched over to the ACA. I think we're going to see increased momentum for at least something that more closely resembles a shored up ACA or even a single payer system.